Well, I'm a plastic surgeon with subspecialty training in hand surgery. So my focus here at MUSC is primarily reconstructive surgery of the trunk and extremities. I see patients from cradle to grave, literally, newborns to octogenarians. So I see a lot of patients with a variety of problems. I treat pediatric hand surgery problems, kids born with extra digits and webbed fingers. I see older people with diabetic feet and limbs that need to be reconstructed. I also treat patients who have problems with breast enlargement, absent breasts, abdominal wall hernias, excessive tissue from weight loss, all of those things. So my philosophy is to treat everyone pretty much the same. I see, as I mentioned, a variety of patients. They come in, we have initial patients have a fairly long consultation. I try to get as much information as I can. And then, along with my residents, we sit and talk and discuss treatment options with those patients face to face. A lot of us have trained in a lot of areas. So I've done complete training in general surgery, plastic surgery training, and then hand surgery fellowship after plastic surgery training. So I did 9 years of training after medical school. My focus at MUSC is primarily, as I mentioned, reconstructive surgery, primarily of the extremities and trunk. My subspecialty area is hand surgery. For instance, at MUSC, we have a large level 1 trauma center. So our service, along with orthopedics, shares hand surgery trauma call. I also get referrals for elective hand surgery such as carpal tunnel, trigger fingers, as I mentioned, pediatric patients who have unusual anomalies. On the other side of the coin, I see primarily reconstructive problems from the plastic surgery side. Patients that have wounds that can't be healed with simple measures. Patients with missing breasts, too large a breast, young ladies that are born that don't form a breast, patients that have had previous abdominal wall surgery and they have hernias that need to be repaired along with the general surgeons. We also treat patients that have cancer. I see patients who've had extremity cancers, or what we call sarcomas, where the orthopedic or general surgery oncologist resect a large piece of tissue and they need to have that area reconstructed in a situation where you can't simply close the wound or put a skin graft on it. We also do microsurgery. Part of my training in hand surgery and plastic surgery was microsurgery. So we do reattachments of limbs, fingers, also move tissue from one part of the body to the other to reconstruct these defects that I mentioned before. MUSC is a tertiary care facility, meaning that we have state-of-the-art abilities to do things such as complex reconstruction, trauma, as I mentioned. We see a variety of problems that other places simply can't take care of. Sometimes community hospitals only have a limited amount of resources, whereas we have nearly limitless resources to treat patients that have complex problems. In plastic surgery, in particular, there are areas in our division that we specialize in. As I mentioned, hand surgery is one of those areas. We have 4 fellowship-trained hand surgeons in my division out of 5 full-time faculty. We also work with all of the other services in surgery and other departments as well. Orthopedics for trauma and orthopedic oncology, work with our general surgery colleagues in oncology and general surgery. We treat pediatric patients, as I mentioned, for a variety of problems. So if you have a problem that's even routine, we treat that, but complex problems in particular tend to come to MUSC from a variety of sources from all over the state, including the Tri-County area and Charleston in general.